Dear friend Swati Narayan from Daya, Houston, we're so excited that you're here, and we're going to be talking about International Women's Month. I know it used to be a day, wasn't it March 8th?
Yes.
Yeah, so now it's a month, right?
Yeah. I mean, it's still the day, but
Right.
it's also been expanded to recognizing contributions of women and highlighting gender inequity
Okay,
for the
awesome.
entire month.
Oh, that's
But if
amazing.
you ask me, we should do it the whole month.
I know, right?
We should do
Absolutely.
it.
So why is it important to highlight South Asian women's contribution to justice and advocacy, especially during International Women's Month?
Yeah, no, I think it's a great question. And first of all, thank you so much for having me here. It's always a pleasure to sit in the booth, with the Chai Time team. And even though it might be gloomy outside, we bring the cheer. Right?
Most
Here.
definitely.
So International Women's Month. I think it might be a good idea to sort of talk about the history
Yes, for sure.
of International Women's Month, because it actually goes back quite a ways. I think in 1909,
Okay.
in New York, there were women who started protesting. They worked in the garment district.
Okay.
And they were protesting wages, poor working conditions, and that caught the attention of some German. I'll call them feminists, but I hate calling them feminists.
Yeah.
But, they were just very astute people.
Yeah.
But it caught the attention of these German women, and so the following year, there was actually a meeting in Copenhagen.
Okay.
And it was a women's symposium.
Mm-hmm.
So this is again 1910.
Oh, yeah,
1910.
exactly. Yeah.
And so there were about 120 women from around the world who convened, and these German women, sort of spurred by the protest of the women in the New York garment district, said, I think there should be a day, or we think there should be a day to recognize the efforts of women, in the workforce.
Yeah.
And everybody agreed. So the following year, in 1911, was the first time it was recognized. And what's really interesting is, International Women's Day had its genesis in sort of a socialist movement.
Okay.
These were women, primarily immigrant and Jewish women,
Okay.
in New York, who were protesting, living conditions and working conditions, more
yeah.
so than living, working conditions. And so that was sort of the genesis of it. And then later on, there were a group of Russian women who were, again, protesting the war. This is around World War I. And how much women had to pick up the pieces when men would go to war, right?
Right.
And so Vladimir Lenin, at that time, I think it was, I wrote it down, 1917, I think, recognized International Women's Day.
Okay.
And that's when I think March 8th was the first date that it was actually recognized.
Okay.
And so it went on, World War I, World War II. Especially during World War II, you saw, again, droves of men going off to war, but the economy still had to, to continue.
Yeah.
So women
Yeah.
started joining the workforce.
Yeah.
They weren't paid as much as men were. And the understanding was that when the men come back from serving, they would take those jobs back, and then the women again would be relegated to
Yeah.
whatever they were doing before. But after World War II, there was a huge jump. The economy had just kind of grown pretty fast, and especially in the U.S., but in a lot of the first world countries, they recognized the need for a larger workforce. So women were allowed to work. I say that in air quotes. But women were, they became, a big part of the workforce.
Yeah.
again, still not paid the same wage that men were. And it was in 1977. Well, before 1977. So you were asking about South Asian women. In the late 60s and early 70s, International Women's Day sort of took on another component, because a lot of this had been driven by first world countries.
Yes.
But then women from developing countries started highlighting the inequities that they were facing. So, you would have women from Vietnam, women, even black women here in the U.S. Started, talking en masse about the inequities they continue to face. So we already know, the effects of slavery on, in America. And then what black women experienced was even, more difficult. And so they started talking vociferously about what they were experiencing and bringing attention to their experience. Asian women started, indigenous women started. So that's sort of when there was a focus on developing countries as well. And so in 1977, the UN designated it as a holiday. A holiday where we don't get the day off.
Yeah.
but it, it was commemorated as a day. And I'm not sure, I think it was in the 80s where it shifted from just the day to like the whole month, to recognize, women's contributions, and also, highlight the inequities that still exist. Even now, I think women get paid 82 or 84 cents to every dollar that a man makes.
Wow.
I mean, that's still pretty significant, right?
Yeah.
And so that's, that's one of the reasons why I think it's really important to recognize the movement, how it began, and how people of immigrant cultures, people of communities of color, other countries sort of came into the conversation, because there are different sort of norms and cultural norms that exist in different areas.
Yeah.
But the experience of not being able to, like girls not being able to go to school at the same in the same manner that boys were able to go, right, for a variety of reasons.
Yeah.
So having a voice around this movement was really important.
That's amazing. So then, what about the South Asian women? You said it was around 1977?
It was, 77 was when the UN formally recognized it.
Yeah.
But, South Asian women actually started, especially like in India and Pakistan and Bangladesh, and, they were uplifting, sort of what was going on in those countries at that time. When we talk about immigration to the U.S., we sort of didn't experience the growth of different diasporas until like the 70s and then 80s. Right?
So, from different places.
From different places, and some came over as immigrants and some came over as refugees. So
can you share with us some historical examples of South Asian women organizing against gender-based violence?
Yeah, and so there's so many things we could talk about, right? But because I'm here representing Daya, and our work is rooted in gender-based violence, so I thought it would be kind of nice to highlight some of the women who have been in this space, because people seem to think, when we talk about gender-based violence, when we talk about domestic violence, that it's something that we've just now started talking about, or the space has recently opened up. And to an extent that's true, but there have been so many people who have come before us and laid down the groundwork for us to be able to do the work that we do, right? So we work on the shoulders of what they started.
Right.
And so I actually made a list of people and I can't remember everybody and everything, so I might read from this. But there was a woman named Shreya Bhandari. She's a scholar and advocate who's conducted extensive research on domestic violence among South Asian women in the United States. I mean, you know, when I was in school, and so I'm way older than the both of you here. But when I was
you don't
in school
look it
here,
for sure.
but when I was in school here in the 70s, right, 70s and 80s, and I'm talking elementary and middle school, and high school, when we would fill out like ethnic background or profile, it was either white, black, or other.
Yeah.
So for the longest time, I was other. Right?
Yeah.
So when you think about somebody who is doing research around South Asian, I'm walking. Somebody who's doing research around South Asian women at a time where for a while we were just looked at as other. That's pretty remarkable, right?
Yeah,
so there was Dr. Shreya Bhandari. Her studies have examined the prevalence of abuse, mental health outcomes, and help-seeking behaviors, emphasizing the importance of culturally sensitive services to address these issues effectively. Also, there's Dr. Anita Raj, and you know we've used a lot of her research in our formative years, and she also did research on intimate partner violence among South Asians in the United States. And in her research, she found that 40% of the people who responded had indicated some sort of abuse that they had experienced. And she sort of emphasized the role of immigration-related factors and social isolation. Again, all of these things are so important in understanding gender-based violence, because in order to be able to solve it or eradicate it, you have to understand the factors that that sort of perpetuate it. There was another woman named Bushra Rehman. She's a writer and an activist whose work addresses the intersection of gender, culture, and violence. Through her storytelling and community engagement, she sheds light on the experience of South Asian women, fostering dialogue and understanding around the issues of gender-based violence. Sujata Warrior, she, I had the chance to meet her this past summer. She's an amazing, amazing person. She was very prominent in the movement against gender-based violence, focusing specifically on culturally specific interventions and training. And she contributed to research exploring the experience of South Asian women, again, facing domestic violence in the U.S. And her work, sort of laid some of the groundwork for some of the laws that we have that exist to provide funding for people in culturally specific communities who are experiencing gender-based violence. There's Minnie Timaraju, and she's actually from Houston.
Oh, wow.
And she's been a vocal advocate for women's rights and social justice, especially when it comes to reproductive rights. And then there was a woman named Shamita Das Gupta. She founded Manavi. Manavi was probably the first South Asian, formal South Asian organization to serve survivors of domestic violence and sexual assault among the South Asian community. That was in 1985 on the West Coast. Sorry, that was not the West Coast. It was in New Jersey. It was in East Coast, in New Jersey. And then after that, Ananya Bhattacharjee founded Sakhi. So that was in 1989 in New York City. And then right after that, between the 90s and like 96, there were other organizations, Chaya, that was on the West Coast. And then in 1996, around that time, Apna Ghar in Chicago, Raksha in Atlanta, and then Daya here in Houston.
That's just, I mean, this is so inspiring. Like, these women just went out and fought for their rights, right? And
Right.
for others.
And for other, that's the
Yeah, it
important
was
thing,
not just
right? It
them.
wasn't just necessarily,
Yeah. And back in the day when it was so much harder, like
there was no social media. There were no podcasts.
Yes,
there were no
no,
radio.
yes,
there was
exactly.
nothing. There was
Barely phone service.
I mean, right?
Yeah,
And yet they recognized like how important this was towards, especially like immigrant women, being able to live a life fully, freely, with dignity and with safety, right?
Yes,
and
absolutely.
so, and you know, and I think these conversations were happening simultaneously in home countries.
Yeah.
I think that, you know, once coming here, there might have been a little bit more freedom to, you know, push the boundaries on how much and what things could be talked about, because there was also allyship in other communities who had experienced it, right?
Issues, yeah.
And so, so these things were happening concurrently. Of course, you know, the resistance still existed, but despite that, they persisted and, you know, and found ways to publish, found ways to do research, and then, and universities that would support them, right?
Yeah.
And then found ways to publish, and that laid the groundwork. I mean, they were trailblazers in this space. I mean, there were other areas also where South Asian women were sort of, you know, breaking ground, but because we're talking about gender-based violence, these women were pretty extraordinary.
That's just amazing. I'm so inspired. So let's talk about Daya Houston. How did it emerge as key organization for addressing gender-based violence in South Asian communities?
Yeah, so, you know, I was just sharing how, you know, these organizations sort of came into existence, and so Daya came into existence in 1996, and it started off as a volunteer organization. There were two, to me, they're aunties, but they saw the need in our community, and so literally on their kitchen table, they started sort of advertising, we're here if you need to talk about something, and it grew from that to hiring one person who could, you know, take on more of the day-to-day tasks, and then the helpline, to where we are now, you know, in 2025, a full-fledged, you know, widely recognized organization. When I say widely, it's not just in Houston, right? It's around the country.
Different chapters.
And the need, and as you know, as Houston has grown, and we've seen more people from the subcontinent and South Asia immigrate over here, the needs still exist, right? To sort of educate and create awareness around what healthy relationships look like, and if you are experiencing abuse, you're not alone. You can call us, and you know, we can talk you through it, right? Whatever, again, like whatever the person chooses to do, the agency is always theirs. We just want them to know that they're not alone.
Yeah, that there's someone for them. So what makes Daya's approach unique compared to other organizations?
So again, you know, the ability to connect with our community in a way that they understand, right? Whether it's language, understanding religion, right? Like, for example, Ramadan has started, right? If you were to go to a mainstream agency, perhaps they may know something about it, perhaps they may not, but we completely understand, like, you know, what's going on in your day-to-day dynamic, especially if you're fasting all day, or And so just being able to talk to people who understand, you don't have to explain
what it is
Ramadan
and
is happening right now, or
the cultural
Diwali,
norms,
right? Like
Yeah.
it's just it's understood, and so when
Yeah.
you have that sort of when you don't have to explain anything, you automatically have a barrier that doesn't exist, right?
Yes.
Like, and so it hopefully provides a sense of comfort and ease that, okay, these are my people. I can talk to them. They will understand. They will not judge. They will not. There's never any judgment. There's never, they get it. And and our staff, and our team, our case managers speak multiple languages. We provide our materials in different languages so that whoever is calling us can understand what is happening in a way in the same language that they sometimes process things in or dream in, right? When you're able to read something in the same language that you dream in, it just makes that understanding and comprehension so much easier.
Yes, most definitely.
So that's sort of one of the elements that we bring to it. And then the other thing is the case by case management, because each person comes with a different experience, like a different, abuse is not the same. And so what might work for one person in the dynamics of that household will not work for another person, right? So we bring that very individualized, case by case support, and like I said, the agency always remains with the person who calls us, the person who reaches out to us. Many times, they may choose to stay with their abuser. And that is, we do not serve as you need to do this or you need to do that. That is not our role. Our role is, okay, if those are the decisions or the choices you have made, talk to us about ways that you can maintain your safety. Right? And so we'll just sort of talk them through that, and or their children and things like that. So
that's amazing. So what are some unique challenges that South Asian survivors of gender-based violence face?
Can we talk?
We can talk.
Okay. So like I was telling you, I mean, you come to a new country, and you may not speak the language, or you may not speak the language quickly enough to go to like a mainstream agency, right? So being able to come to us helps. Sort of understanding how, not to ensure that our survivors who call us don't feel like culture is being weaponized, or that there's nothing wrong with our culture per se, and that helping them talk through what they are going through. I mean, those are some of the stigmas, because they come with this preconception of how things should be, right? This is what I saw. I've seen marriages where the spouse does this and the spouse does that. I thought that's how it should be. And so again, being able to talk to them about what a healthy relationship should look like, regardless of what culture you come from, what religion you come from. A healthy relationship is a healthy relationship, right? It's built on mutual respect, right? So, sort of being able to talk to them about things like that. And then, and again, sort of navigating, when you first come here, you may not have a car, you may not have, you may not even know where to go get groceries, right? Things like that. So we're able to help them, with all of those things.
With all the minute details. how are organizations like Daya?
Take a
We're
break.
gonna take a quick break, and we'll be back right after the break. We're having this very interesting conversation with Swati Narayan from Daya, Houston about International Women's Month. So, how are organizations like Daya addressing these challenges?
Before the break, we were talking about sort of.
Unit.
We were talking about some of the challenges
Yes.
that, and there was one other thing I was going to add, and I kept looking over thinking, okay, we're about to break, we're about to break. But one more thing that we help support and provide is, when somebody comes here, even when they don't come here, like you live here, navigating the legal system is not easy, right? Trying to figure out if you're trying to get a protective order, if you're trying to just anything, right?
Yeah.
So that is something else that we help provide services for and support.
And that's great.
Or even the healthcare system, right?
Yes.
Trying to navigate that, where you can go for specific doctor's appointments, or the kind of doctor you might need to see, or immunizations for children and things like that.
And this sounds so basic to us, right?
Right,
Yeah,
exactly.
but someone who has just moved here from another country knows nothing,
Right.
Like this is very important detail.
It is. I mean, just think about like when you travel abroad,
Yeah,
right?
true.
And you may be just going for a vacation or something, but you don't quite know, like, okay, where is this supposed to be?
Yeah.
Where is that supposed to be? And so you ask the locals, right?
Yes.
And so it's the same thing.
Yeah.
But when you have, gender-based violence, when it's layered with the issues of, abuse or violence, sometimes even wanting to ask that question becomes a little bit more difficult, right?
Yes.
So being able to talk about that without fear, without worry or of anything, really. And it's so interesting because they might our survivors or people who call our helpline, they may start off with, I just have one question, and then it's and this and this and this and that,
because they feel comfortable to. And I love the example that you give of going abroad, like when we went to Spain, and if most of them are talking Spanish, if we find an English speaker, you're so excited, right? Because they understand your language. But so the same thing with Daya, if you're speaking their language and their culture, I'm sure that just warms them into it,
absolutely,
right?
Absolutely. And so that is what we aim to sort of close the gap. That's where we aim to close the gap. Is, those challenges that they may feel because they might not speak the language, and even if they do speak the language, right? Just not wanting to have to explain the culture or the background, like just being able to go to somebody. One time, I think I've given the example here before. So one time, this was me personally. I was looking for a therapist. I just wanted to talk to a therapist about something. And so I was kind of doing my research.
Yeah.
And I met this one therapist. And so we were talking. And I said, well, I did want to talk to somebody who sort of understood, like my background, what it might be like in a Desi family, right? And even though I grew up here.
Yeah.
And she goes, well, honey, don't worry. I grew up in Appalachia. And I'm just thinking, as kind-hearted and gentle as she was, West Virginia, Appalachia is not the same thing as growing up in. And we had English as a common medium, right? We could talk. Yeah. But it was still like I didn't want to have to explain things.
Yeah, right.
And so, so that's that's sort of how we're able to bridge that gap and make people feel a little bit more comfortable.
That's amazing.
And then I think you had asked me, like, systemically, how does that work towards affecting change, right? So, I mean, it is the work that we do, and I think I had mentioned that we are, we've been recognized many, many times, like here in Houston, but then broadly across, the U.S., we're also part of a lot of coalitions, right?
Okay.
Because none of this work can be done alone. Learning from other organizations about what they see, what they experience, and we're always stronger together, right?
Yeah.
And so, so we're part of like national organizations, we're part of statewide coalitions, and we use the strength of our coalitions to work, on advocacy issues, to ensure that, the rights of people who have been affected by gender-based violence. And I know we're talking about International Women's Day
Yes.
and gender-based violence, but gender-based violence doesn't happen just to women, right? And so, so making sure that advocacy is inclusive of all,
Right.
so that there are enough resources and tools available to all these different organizations to do the work that they do.
Okay. Done.
So that coalition building, working in tandem, working with, and recognizing that we can do one part. We need other organizations, other entities to understand what it's like for South Asian survivors. It just broadly, it creates a much more holistic view of what gender-based violence looks like across communities. And then the other thing is, and I keep talking about, our communities because we are, on Chai Time.
Yes.
But we are completely inclusive in, in our approach, meaning that you don't have to be South Asian to call us. We do not turn anybody away.
Oh, wow.
And so anybody who calls us, we will provide services for.
Oh, that's amazing. And then who are some other trailblazing figures working on justice issues for South Asian women?
Yeah, so justice, right? When you think about justice, it's not just necessarily in a court of law, but it's about equity, making sure that everybody gets what they should have. And so, there are people like Vanita Gupta, who had worked in the Department of Justice. She actually had their Civil Rights Division under President Obama. There was a woman named Jennifer Rajkumar who passed landmark legislation protecting domestic workers and expanding support for crime victims in New York, which then broadly translated into legislation in states across the country. I talked about Sujata Warrior, I talked about Minita Maraju. But then, we can even look here, right, in our own city and where we are. Rachna Kare, who used to be the executive director at Daya, she's a trailblazer. And, if you go and talk to people across the country, they've all heard of her and they know her. But then even here where we are, this whole Chai Time team, right? When we talk about advocacy, how can we not think about the work that you all do, right? Creating a platform, creating a table where people can come and talk about issues. Sometimes people try to, sort of shy away from issues or sort of sweep it under the rug. You provide a very comfortable, open platform where we can have honest dialogue.
Yes.
And that is so important. And that's, in our communities, in our homes, in our, within our families, to be able to have these kinds of conversations.
Yeah, that's so.
Can't overlook what you guys do.
Thank you. I really appreciate that. So looking ahead, what does the future look like for addressing gender-based violence in South Asian communities?
It's more of this, right?
Yeah.
It's more of having open conversations on the airwaves, in masjids, in temples, in gurdwaras, in coffee shops, in places at work. It's normalizing what healthy looks like,
Yeah.
so that we understand that if when we see something or feel something that seems intuitively wrong, we're not afraid to go and talk about it.
Right.
And also, when we normalize these conversations, those issues of, judgment or that "log kya kahenge," all of that kind of just goes by the wayside, right? That's not an issue anymore because we've taken control of the narrative,
Right. Yeah.
And so, I think things like that, and again, working together with people, with other organizations recognizing that, okay, these things do exist. How can we lend our support? How can we help so that our communities feel safe?
Yeah. Yeah, and they're not just surviving, they're thriving, right?
Exactly.
Yeah.
Exactly.
As we wrap up the discussion for International Women's Month, what message would you leave our listeners?
Don't be afraid.
Yeah.
We've come such a long way. When you think about women and the rights that we previously haven't enjoyed and what we are able to now, it's great.
Yeah.
It's not enough. We have to keep, don't become complacent, right?
Yeah.
Keep pushing, keep talking. Don't ever accept less than.
Yeah.
Right? Because everybody deserves to be happy and to, like you said, to thrive.
Yeah.
Right?
Yeah.
And so, and I would say that, continue to talk about, some of these issues. And, if you're in question, or if you're wondering, even if you're just wondering, is this normal? Is this the way a healthy relationship should look like? If you need that support, you can always call Daya. You can always call our helpline. And
because like you said, just don't accept less, because I feel like the norms in and the culture that we come from, women are just I guess they've seen it, right? Our moms have been the housemaker, been at home taking care of the family, taking care of our dad, and then when you get married, you moved into this country. It's something different because now you're working too, right? And then on top of that, if there's abuse, I think Daya, because we've had so many conversations, Daya helps to see, I had no idea there is we know about physical abuse because you can see it, but what about mental and emotional? I had absolutely no idea, right?
Yeah.
So, educate yourself. I mean, if not anything, listen to conversations, so you will know the difference of what healthy looks like.
Absolutely. That emotional abuse. Again, the bedrock for all relationships is mutual respect.
Yes,
right?
yeah.
And so when somebody's berating you and yelling at you and putting you down, that is a form of emotional abuse, right?
Yeah.
There's elder abuse. We didn't talk
yes,
about
we
that,
did.
right?
Yeah,
but that is...
Did not know that. I learned that from Daya, your in-laws, constantly yelling. And because I've seen that happen to my mom, right? And for me, then it's normal. But that is not normal in any way, right?
Mm-hmm.
And I had no idea.
Yeah, it's, elders doing that to you and vice
versa. Yes.
Right? Or even when you have elders who, as they've grown older, maybe they are cognitively not as aware as they had previously been, right?
Yeah.
When you get older, you're not thinking at the same, you're not
Yeah.
able to process things
at the
way
same rate. Yes.
you used to. Sometimes, dementia might set in and things
Yeah.
like that. And sometimes you'll have family members who will sort of take advantage of that
Oh.
and try to, sort of come between or say that, mom said this or dad said
Yeah.
this, when mom and dad really
Yeah.
don't have the ability
Yeah.
to make those kinds of decisions
Right.
anymore. That's also elder abuse, right?
Yeah,
when
yes.
you take advantage
Of your
somebody
seniors, yes.
who,
Yeah.
So there's a lot of ways of looking at things, and at the end of the day, abuse just means like this is something that is beyond mutual respect,
Okay.
and
That's okay.
and it can be very severe. It can be sort of just beyond what is acceptable.
Yeah.
But for you to navigate and figure out how you want to handle this
Yes.
is where we come in, if you want to talk about it,
Yeah.
and help you make the decisions that are
Yeah.
best for you.
And that's the best part is, I think, with Daya is they don't push you to do
Oh, no,
anything.
we don't
Because
say
that's
anything.
another thing I remember is that it takes 7 attempts for the abuser to leave, for the person being abused to leave, right? So, but you're there throughout that, not
there.
judging, So I think that is so important, right?
We are literally that friend,
Yeah.
that support. Whatever you choose to do,
Yes.
just know that you're not alone. That's
Yeah.
it.
Yeah.
Whatever your choices are, you're not alone.
Yeah.
So,
So,
it's hard enough.
yeah.
And then to be alone makes it so much more difficult. But with Daya, you never are. Daya, our name means compassion.
Yes.
Right?
Yeah.
And so
Yeah.
that is what we try to provide everyone, anytime they call us. And that's part
Yeah.
of our ethos. We're
Yeah.
here for you.
That's amazing. And do you want to share the number to call?
The helpline number is 713. And you know what? I just want to make sure that I
Giving the right
give
number.
the right number. Yes. Oh my goodness.
I know. I feel like I
you?
knew the number, right?
I know the number.
Yeah, I know. We have the number in the app. I
number's
should know that by now.
Well, I've said it so many times, but then the worst thing is I am afraid to. Oh my goodness.
No worries. We have DayaHouston.com, right?
It's DayaHouston.org.
Org,
DayaHouston.org. And our helpline number is 713-981-7645. And I should have known that.
It's okay.
But 713-981-7645.
Yeah, that's the beauty, right? We just.
I know.
I know.
And I have so many different. If you were to ask me what my children's phone numbers are, I don't know their phone numbers. I have to look it up. The only number I know is my husband.
Me too. I'm
only
guilty. That's the only one I know. But thank you so much for being here. Do you want to share any events that Daya is having? That you want to?
We will. So later on this month, on March the 20th, we will, in conjunction with Asia Society, we will be hosting. So there's a movie called To Kill a Tiger.
Okay.
It's on Netflix, and it is about domestic violence in India.
Okay.
But the producer and director, it's an Academy Award nominated film.
Oh.
And the producer and director will be here.
Oh, interesting.
As well as the man. So it's actually about how a man takes on the issue of domestic violence. And so he will be here as well. So we're doing that on April the 20th. And it is it's a free event at Asia Society. So
That's amazing.
You can register. We will have we will be sending out a link to register.
Okay.
And you can go on Asia Society's website as well. And
That's
register.
amazing.
Yeah.
And thank you again, Swati, for taking the time and being here and enlightening us with this conversation. I feel like every time I learn something new and it sticks,
Yeah.
So,
well, thank you for,
yeah.
again, like I said, providing this platform and for allowing us to come and have these conversations. And thank you for your voice in the community.
Thank you. Thank you so much. Thank you to our dear listeners and our sponsors, and we'll see you next time, same place.